All evening long, we've been telling you about the incredible bond between humans and their dogs. But what happens when it's time to say goodbye?
Medical advances have made it possible to keep our dogs alive much longer than in the past. But the financial cost can be high, as can the emotional cost when you realize it's time to let your dog go.
It's a good day for beautiful Beckham, a 13-year-old diabetic, a fighter and a survivor.
I do think this guy's been pretty special.
6 months ago, the Old English Sheepdog was diagnosed here at Pittsburgh Veterinary Specialty and Emergency Center with a slow-growing lung tumor, causing dangerous episodes of pneumonia. His owner, Diana Minaw, wrestled with what to do. While her husband didn't want to see the dog suffer and wanted to surgically remove the tumor, Diana was against it.
If he dies on that table, I won't forgive you. Because I felt like I didn't know if he would make it.
But Beckham made it through the lung surgery. And while he's now comfortable, he's also slowing down, losing his appetite.
You know, I've asked Dr. Peterson, is that way of him telling me I'm done? Because I do think, you know, we all, whether we're an animal or a person, deserve like a death with dignity.
Diana calls Beckham her beach house because they've spent thousands on his medical care.
It's worse than
But despite the high cost from specialty hospitals and doctors, these difficult decisions are not always based only on money.
One of the biggest conversations we have is quality of life. You know, what does the animal come in with? What's the dog come in with before we treat? What was the condition like before this event occurred?
At PVSEC, Dr. Anthony Pardo says they discuss all the options, both financially and medically.
At the end of the day, they have to be able to figure out how to do this. And it's okay sometimes just to be a nice guy and say, you know, if this doesn't work for you, it's okay not to do it. You don't have to do this, and you shouldn't feel guilty.
There is never really a right or wrong as long as the pet is not suffering.
You know, I'm just going to check you out.
Dr. Melissa Ackerman is a general practitioner with 8 German Shepherds and 6 other dogs at home. She refers many clients to specialists and depends on them.
They are wonderful about giving us advice, even if it's a patient they're never going to see. So we are really lucky to have specialists in the area that will give us help and advice when we need it, when we need extra help figuring stuff out.
You okay? You get to go home too.
Addressing the high costs of care, Dr. Ackerman has seen a spike in owners benefiting from buying pet insurance.
And I have one client that has to bring a dog in once a month for about $120 shot a month. And the pet stays perfectly healthy if it gets this injection, but if it doesn't, it would pass away. And she is so happy she has health insurance for her pet.
One key, in addition to determining the cost, ask the specialist, is my dog's condition fixable?
We love her, and we would give her the same level of health care that we would seek for anyone else.
Pat Bednarek is talking about her Cairn Terrier, Cheyenne.
She crashed, and so we had to come in through the emergency room.
Something fixable.
Doctors at VCA Northview Animal Hospital diagnosed Cheyenne with a life-threatening kidney infection. Pat, an otherwise calm, confident dog mom, suddenly panicked.
Fear that she's going to die, fear that she's going to suffer, desperation. Can we get through this? You know, can my dog be saved?
I think we're due for some blood work and a urine culture today, right?
Dr. Lisa Asandri believes Cheyenne could be saved, addressing the condition as well as the cost with Pat, who gave Dr. Asandri the green light.
We want to know whether the patient's going to have a good outcome, you know, if they're going to have a good quality of life when we're done with whatever it is we're going to do. It's not all about money.
Some owners feel guilt over spending too much money on their dog, or feel guilty when deciding against treatment because it costs too much.
How is she doing at home?
That's when owners rely on the doctor's expertise to help determine what to do.
I think, and I always try to reassure people that what their heart is telling them, I'm sure, is what we should listen to. Okay, baby.
That's exactly what Diana listened to, deciding what's best for Beckham.
I think that you have to just follow your own heart, and every dog's different. I know the choice I have to make, it's just what day.
And the question Pat asked herself for Cheyenne.
We look at them as members of our family. And what would you do for someone you love?
Next on Chronicle.
On any given day, it can feel a little bit like operating an emergency room in a war zone.
Pittsburgh's animal shelters, sometimes a place to say goodbye.
Emotions are raw right now. He was a good dog. He got me through a lot of nights. He was a family member.
And sometimes a place for a new beginning. Next on Chronicle.